morning, everyone. I'm Gail Lee. I'm the president of the board of Aging Advantage, and we're doing this presentation series in partnership with Eamon Gantner and Capriano, Your Estate Matters, LLC. So far, we've been covering some legal perspectives on our roadmap here. We are Aging Advantage. You can kind of go forward here. Who are we? Well, we're a local nonprofit organization that we help the elderly in the community and the disabled. And through some funding through St. Louis Area Agency on Aging, we can help different households that have experienced negative public health or economic impacts due to COVID-19. So some of the different services that we do offer is care management and mental health support, home delivered meal assessments, care coordination, which is help applying for different benefits. And we do a lot of these classes virtual in person for through the ARPA funds and also family caregiver support. And so we are doing this program through that to try to help people in the community get prepared. So this is your roadmap to planning, protection, peace of mind. And so far we've kind of looked at the overall view for estate planning and the 5 legal must-have documents. The law firm is made up of, I'll let you tell, Amanda. That's your part.
So Gail actually works at Eamon Gantner and Capriano as well. But we are estate planning and elder law attorneys. So we dedicate our legal practice to just that, estate planning, elder law, and then we also do sort of the postmortem stuff. So that's trust administration and probate matters. We are all members of the National Academy of Elder Law Attorneys and the American Academy of Estate Planning Attorneys. And we're accredited by the VA to handle veterans claims. So that helps us, go through processes like aid and attendance with clients, get them applied for and approved for some of the benefits that are offered by the VA.
Yeah. Go ahead. You can tell this part. So today, well, Amanda talked about the other topics, and today we're both going to talk about care management and choosing your care. What is it? What's the role of a care manager in this whole process, and how choosing the right care, whether it's home care, assisted living, memory care, nursing homes, what to look for, what kind of things to ask, and just the whole gamut of it, which people do wonder, well, what does it have to do with the law firm? But it has a lot to do with it, as I think Amanda's been finding out since she's been here.
Oh yeah, and we hear from clients all the time that they're so grateful that we had social workers in the office who really know more this realm, this side of elder law and elder care. I don't have the experience or the background in sort of some of the social work topics that we're going to talk about today, but Gail does and Maggie does, who we'll introduce in just a few minutes here. And so it really just helps us get a holistic idea of not only do we have a financial plan and a legal plan, but we also have the human side of it too. What type of care will best benefit this person and what fits with their family lifestyle and what is the best way to support this individual through whatever type of care that they might be needing. So it's a seamless part of this sort of whole process. So this is me. I'm an attorney licensed in Missouri. I got my BA in English and economics from the University of Mississippi, Ole Miss. And then I got my JD from Wake Forest University in Winston-Salem, North Carolina. Then I moved home to St. Louis. I was from St. Louis, born and raised, Koryezu girl, if anybody's curious about high schools. And like I said before, I'm a member of NALA and the American Academy of Estate Planning Attorneys, and I'm accredited by the VA to handle VA claims.
Yeah, and I started here at the law firm exactly 20 years ago. So, I was the first care manager here. I do have a master's in psychology and gerontology. I'm a licensed clinical social worker, a certified care manager. And, my early background was being in the military, and that's what I did in the military and civil service for the government, and then eventually switched to elder care. And did a lot of care management in the community. So um, besides working here, I do have where I'm the president of board for Aging Advantage. And so it's kind of, aside that, I've always wanted to be a social worker and help people in the community. So that's what we do through Aging Advantage. So, and then here at the law firm, of course, we have a whole comprehensive team that's looking at all these issues. And we even have an additional social worker. It's not part of our elder law team, but it's part of the law firm team.
We all really, I mean, we work together constantly. We all, we like to take a team approach with our clients because, things that I might know, Maggie wouldn't know, or things that Gail is really good at, I'm less strong at. And so we really like to take a team approach and sort of brainstorm to come up with the best holistic plan for someone as they go through this whole aging process, which is what we're kind of trying to walk you through this whole series, right? Is okay, what does aging look like and what sort of plan do I need to have in place? And what are some things that I really need to be thinking about?
Yeah. And yeah, we were just talking about this whole thing and kind of added this in there too.
That's right. Yeah, we were just talking about this. So, and we've sort of answered this question, right, in each of the presentations we've given so far, but it's sort of our overall, what is elder law? What is elder care? And why is it so important today? Why do I need to have a plan in place? Why do I need the legal documents like powers of attorney and healthcare documents set up beforehand, especially when I'm thinking about aging? And just a few realities are that people are living a whole lot longer today than they ever have before. It's because healthcare is improved. It's because we don't have people dying of acute illnesses anymore, or nearly as much anymore. We don't have young people dying of a lot of the illnesses that cause individuals to die in early childhood or young life. And so now we sort of see individuals who suffer from chronic illness a whole lot more. And by that we mean, dementia or cancer. Obviously you think of, there are some big, debilitative chronic illnesses, but for the most part, that's what people are suffering from. And that's why people end up needing long-term care of some sort, whether it's care in the home or care in a facility. We also have,
they're living longer, but yet they do need help with those activities of daily living, the eating, the dressing, just to kind of keep their quality of life up. We were looking at the statistic before. It seems like there's 1.7 people, at least they need help with 1.7 of the 6 ADLs. So just about needing that help. That's the average that people are needing. And so they need that support and help to stay comfortable and to keep quality of life. Because if we're living longer with those disease processes, we need to make sure that we have a good quality of life going.
yeah, that's exactly right. And I found this statistic that's sort of on the side of the screen here, pretty astonishing, that for the first time in US history, older adults are projected to outnumber children by 2034. So we just have this massive aging population, and it's going to be a large area in
Mhm.
which a whole lot of people will need to focus is how are we going to take care of this large population, and what does that look like? And the earlier you start thinking about these things and talking about these things, the better off you'll be.
And I think that, you know, care management, it does help us to bring clarity and coordination in these complex situations. And what's the biggest challenge with that care? A lot of it is not talking, like a lot of times it's uncomfortable. It's uncomfortable when the family's facing that. And so, so we don't get into that. And it's really important to start that conversation early when it's not an emergency, knowing when, what, and how, how to say things, how to do things. I think we talked in one of the other times too about how it's hard to talk to your parents, and get their finances and their wishes, but it's so much easier to do it when you're not in a time of crisis. And so um, we're just looking at, I looked it up, it's about 47% of people over 40 are kind of stuck in that middle ground where they're just trying to help their parents, but they also have their job, they also have younger kids, they also, they're being pulled in all these different directions. So kind of taking that maybe slower approach when it's not an emergency to kind of figure out and try to help figure out where to support when. I think that a care manager is a professional point person. They're able to help coordinate that help. They're able to look at how can different benefits that there is out there, how can those help financially? How can they who can provide the emotional help? There's a lot of emotional stress when you're assisting people with trying to find out what's the appropriate care, and you need to free up the time for the caregivers to focus on their family and really just being able to have a relationship with their parents that's more of a relationship that you've had your whole life instead of just all of a sudden trying to parent them. And so it gives them back that time that they had with their family. And it really helps their loved one, the elder person, to be able to stay independent and stay safe in their home longer. If you can kind of get these pieces together and look at their care needs. I know you just recently sort of went through a situation like that yourself, Amanda. It seemed like with your mom.
Well, and I was actually going to say that I've seen this so many times with our clients that a lot of times they're not as open to speaking about some of these, care concerns with their children as they are with somebody like Gail or
Yeah.
Maggie who have seen it and they know how to ask the right questions in the right way. And I know Gail will laugh at me here, but I'm sort of a coddler, right? I'm a little too nice about things sometimes, and she has a way she can sort of direct people and keep them in this mindset of, okay, what are we doing and what do we need to do next, and what does this need to look like for me now? And it really is, it's a talent that needs to be honed. It's not just something that you can wake up one day and, call your mom on the phone and say, you're really having some trouble getting around now. What are we going to do about it? And it just helps to have that sort of third party there. You're not mixing family with some of these care decisions where there's more emotion involved and more pressure involved. Maybe it keeps that degree of separation there that's very helpful. And even when it comes to the smaller things, like we met with a client a couple months ago who had been taking care of her aunt, and her aunt had a dementia diagnosis and really didn't want to stop driving, but she kept getting lost. And so Gail went in and talked to the niece about sort of some strategies to let's figure out a way to stop your aunt from driving in a way that's not going to create more animosity, because at this point she was unsafe to everyone on the road, and it was a safety concern for herself too. But we didn't necessarily just want her niece to walk in there and say, "You're done now," and yank the keys and leave. Um, so really it's, I mean, the spectrum of what care management covers is very, very broad. Um, and can be super helpful for most people. And I mean, we've had clients who have applied for benefits solely for the purpose of they wanted somebody, a care manager, to come in and help them with some of these decisions. So we really can't stress enough that that's a very beneficial person to have, to know, to think about.
Yeah, I think it does. It just helps leave a lot of it's having a professional that's understanding all the different systems. They're super complicated, and that's why I like this benefit that the city of St. Louis offers their residents for no cost in terms of having a care manager from some of the different providers that were able to go in and help figure out what benefits can keep them safe in their home. And I just think that time savings and the whole thing. And I think in that circumstance that you're talking about, we used a care manager to go and talk to that loved one about it. But yeah, I think, it's important to be supportive and nice like Amanda is, but the people don't get sometimes the sense of urgency of, and having that roadmap and that plan, like, okay, we got to get the documents and stuff together.
I like to think it's a nice good cop, bad cop thing we got going on here. So these are sort of your 8 core areas in care management, and I'll let Gail talk about these. But it's mostly this visual is just to help you understand that it's not one thing in a vacuum. Care management is looking at sort of all aspects of support and implementation of a plan to keep someone safe and having the proper care that they need and in the place that they want to be at.
It's really putting together, having that point person, like we were talking about, and putting together that team that's looking at all these different aspects. A lot of times in the hospitals and stuff, sometimes you hear of a patient advocate. That person's just focusing really on health, but nothing is happening in a vacuum. And you just have all these different aspects going on. People might need this certain levels of care, but can they financially afford it? What's the housing? What's their family like? Do they have other support? I think I was mentioning to you earlier, there's a big rise in just solo agers and people, and they don't have any children and they don't have any parents and maybe not too many cousins, like they're by themselves. We have plenty of people come and say, I don't know who's going to be my power of attorney. I don't, the people that I had that are close, they're aging too, and they're not able to support. So someone that can be an advocate, someone that knows local resources, or can pull those resources in. And of course, the legal, which we've been talking about, making sure that you have the right documents and people that can step in when there is a crisis. But hopefully you've, obtained some care management or look at the situation early enough that you kind of have this a little bit laid out so that when that crisis does happen, then it's easy to pull in those supports.
And I know we have lots of clients, for example, with family members who don't live in St. Louis or even in Missouri. And so it makes it a lot more difficult for those family members to help when there's a situation like this. And that's where a care manager is a great liaison to sort of be the boots on the ground, and sort of keep in contact as well with the family members and let them know what's going on and what support is needed from them. And so I is just an aside sort of, but
Yeah. So we're you know, when we're doing it, we're looking at what are the care needs and creating that plan. So really what's the current need? Getting started talking to those to the to the parents or the future caregivers, that not when it's a crisis, asking your parents, talking to them, even though it's uncomfortable. Um, what's their preferences, what's their values and wishes in those different areas. You know, most of us too, we're just it's uncomfortable to ask our parents about their finances, and get to know their advisor and get, if you have your powers of attorney, getting that on at the bank, being able to access what you need when you do need it. And say to people like, you know, it is really hard about when you're talking in terms of independent assisted skilled nursing, people aren't necessarily wanting to leave their home, but going to look at places, going to visit, going to sit there and eat or see the activities, and because you can very easily see, well, I don't like this place, or this one might be acceptable. It's like getting that idea of what's in the community ahead of time. Um, and it's really hard to know sometimes where to start. And so I think a care manager can help start that and help get that plan in place and look at what the current needs are. You have to start looking at what's might be changing for them. Like, are their eating habits changing? Is there weight loss, appetite loss, the relationship patterns they have? Are people in their orbit, like their neighbors or friends, expressing concern to you as a family member? Are they decreasing or stopping their participation in activities, like joining in at book clubs or things that they enjoy doing, or their church or different groups? Looking at the things that might be getting neglected, like their personal hygiene, clothing, the, body odor, oral health, their nails, their skin, maybe their home's not tidy anymore. There's just all kinds of different things happening. They're maybe exhibiting inappropriate behaviors, or they're loud or quiet or paranoid or agitated, making calls at unusual hours, being forgetful, or their mail's piling up, or there's newspaper piles or missed appointments, mishandling finances or bills. So, or just showing signs of physical injury or burns or weakness, forgetfulness, like, are the injuries because they're not safe, they're falling down. So it's really important to look at those things. It's harder to manage independently. And for them, how do they define quality of life? Some people are like, I'm never leaving my house. But what's important about the house? What's important about that quality to be there? And then really looking at what supports are needed to preserve those different quality of life issues. And just again, looking at cognition changes and what aligns best for them with their values and their priorities.
Well, and I'll say all too often we have clients who come in here who, maybe mom has a dementia diagnosis from 2021
Mhm.
and they haven't thought of this until mom cannot, dad cannot possibly care for mom in the home anymore. And really, they should have come in. I mean, maybe when they started noticing the signs of, something's off, or even when you get that diagnosis. We have the same problem with clients who might have been diagnosed with cancer or these other sort of degenerative illnesses, that the time of diagnosis is a great time to start having some of these really hard conversations, because by the time you come in here and it's an emergency, part of it makes the planning much, much harder. And a lot of the times we can't get these answers necessarily from the person who actually needs the care themselves anymore. And so really, if you're a little bit proactive about it, it helps to make sure that that person ends up with the quality of life that they really care about, not what we think would be important to them. Um,
And I think a
but
lot of times the kids don't know what's important
right.
to the parents because again, being uncomfortable to talk about those issues.
Or even the spouse, right? I mean, think of all the spouses we've had who, put themselves at great physical and
Hmm.
emotional, disadvantage because they say, well, I have to keep my spouse here. That's what they would want. And you just think, well, is that really, if they saw you right now, is that really what they would want? Or is it just something you never talked about? And they're sort of the separate emotional problems, the guilt that comes along with that and things like that. But if you have those conversations ahead of time of, okay, what do we do when if I can't lift you and you can no longer get out of the bed by yourself, or if I can't keep you in the house, or if I can't, if you don't know who I am and so you respond aggressively toward me, what would you want then? And that is a huge point where care managers can ask those questions because they know to ask those questions. Everyday people you just don't think about, these are all the things I will need to know one day.
Right. I can't even really count the number of times where we're going along with the plan and you have the healthy spouse that's taking care and they're doing all these things and they're working. And a lot of times people's health is maybe they're a couple and they're functioning okay together because maybe one has some memory things, but the other one has some physical limitations. And so they tell their spouse that has the dementia they kind of keep them on track doing those physical things and giving direction and vice versa. But so many times that healthy person's right running themselves ragged and they end up falling and hurting themselves or just they're just exhausted and they're just really trying to make sure that the unhealthy one gets placed and gets in a facility. And then I've just seen so many times that it's the healthy spots that all of a sudden we get a call, okay, my mom or dad died and they were the one that was healthy. I think that you've experienced that here already and you've been kind of shocked. And I think it's happened more than once since you've been here and you're like,
Oh
wait,
yeah.
what?
And it was one of my very favorite cases and one of the first that I worked on pretty intensively. Um, and it was a case where the wife had dementia and the husband was a wonderful man. And he had worked so hard to get her, a place. She couldn't stay at home anymore because she was aggressive towards him and more didn't recognize him. And so she thought that he was an intruder in the home. Um, and he would have to call the police. And so sort of finally had gotten her all settled, and then he got a cancer diagnosis, and they passed away within, I would say, a month and a half of one another. Um, but from the time we first met him, you could see his decline. I mean, even before the diagnosis, it was taking so much out of him. And I wish we could have helped them far before they came to us, because really, I don't think she should have been in the home for as long as she was. But, their kids were both middle-aged with little kids of their own, and you try your best, and he didn't want to be separated from his wife. And at one point, Gail had to tell him to stop going to the facility because he was spending 18 hours a day at the facility with her. Um, so all of that to say, these conversations, the earlier we can have them, the better off it is for everyone involved. I mean, for the kids, for the parents, for, the individual receiving the care, especially, yes, but for everyone involved.
Mhm, mhm. So when we're starting, and there is all different levels, there's in-home care, assisted living, and then memory care and skilled nursing, but a lot of people get confused with this memory care. You have assisted livings that have memory care, and you have skilled nursing that has memory care. So we'll kind of talk about that a little bit, but you have to look at what matters most to me in any of the care settings. And I think it's important to look at safety, companionship, getting there, and having those familiar surroundings, and medical oversight. So especially sometimes with dementia diagnoses, it is more beneficial to move into these situations a little bit earlier so that you do get that, imprinting and are able to process a bit more about where you're at. But early on, there's a lot of even steps before you're having home care per se, looking at how to stay in your home independently. And the first step might be just looking at getting some help in your home, whether it's yard work and different repairs, housekeeping, things that are helping to relieve that physical labor in the situation. There's also a lot of smart devices. I think we were looking at some of those a few minutes ago, and you have the medical alerts and you have the different cameras, and I'm just trying to see if I have that whole list of them again here. But you there's working on making your house have like no step entries. People tend to have their houses set up and think that the rooms have to function the way they always have. Maybe there's no first floor bedroom, but possibly the formal dining room that no one's using can be converted to a bedroom. Having the grab bars, having maybe a raised toilet, having wider doorways, and really just like even reachable outlets and doorknobs and countertop heights, looking at all those type of things. Recently, I went to a conference where we toured a different smart home that was being able to, turn on lights, turn on the TV, turn on just different things. And it was monitoring what was in the refrigerator, and it had a lot of things in the bathroom. Like it had a very fancy toilet that if you were going to the toilet, it picked up on if you had a UTI, or even the start of things like colon cancer and things. So there's just all kinds of things that can be, set up. So when you're looking at that kind of stuff, then you start to look at next, what kind of help do people need in their ADLs? And so that's where you start looking at some of these features that can be put in there, but also then what kind of home care, or maybe they just need someone to get their groceries for them. And then looking at the quality of life issues for them and making sure they're not isolated or they're able to get to their activities. Within all the realms, you're looking at safety as a top priority. Like if you can have fall prevention, maybe they need some exercise classes and strengthening for that stuff, so they're not falling and leading to more costly interventions. And then you have to start to look at if they are having some memory things, setting up maybe some monitors or those smart home features. Looking at ways just to get the family more involved, whether it's the siblings or grandchildren, family meetings to look at setting expectations or being able to check in and provide some support without, overwhelming in that sandwich generation there. But, and what are, just the biggest top three things that matter to me in a care setting, looking at that, maybe companionship, safety, family surroundings, medical oversight, and kind of discussing what those biggest fears are about moving to the higher level of care, and kind of how to address those fears. And then as you're moving to these higher level, how am I financially going to pay for it? A lot of people want to stay at home too, thinking it's less expensive, but a lot of the home care options can be more expensive. I think you were talk about mentioning some of this, like the assisted living and skilled nursing and the differences in the costs and who's paying for them. That's a
Right,
great.
right. And we'll talk a little bit more of that too, I think, in our next series when we kind of go over, okay, what do Medicaid and VA benefits look like? But generally speaking, um, I would say assisted living facilities in the St. Louis area right now in the neighborhood of $7,000 a month. And I would say skilled nursing would be in the neighborhood of $10,000 a month. Um, but then at-home care is also extremely expensive. I mean, Gail, correct me if I'm wrong on this, but $50 an hour? I mean,
So it's like between 30 and 40 right now,
okay.
typical. Yeah.
So, and the hard reality of that is it just adds up quickly. Um, and the
Yeah,
other thing,
if you get to the 24-hour care with that.
right, right. And the other thing I was going to mention here too, that, I know you talk about a lot with people when they're sort of looking at what kind of facility are we looking at and where. Because everyone will have an opinion on, oh, this facility is good, or oh, this facility is known for being really expensive, but it's the nicest, and this facility isn't known to be good. Well, first of all, turnover is very high in nursing facilities. So a lot of times it changes quickly based on the staff who's there. Um, how good the care is that you receive. And some facilities do have a good retention, and I think that's one of the best signs that it's a good facility to work at and it's a good facility to be at. But even more than that, we always talk about location to loved ones, right? And the closer the facility is to, someone's family members, the more often they'll visit. And the more often they visit, we think, what, correct me here too, Gail, but the better off this situation tends to be for the person who's there. They receive a little bit better care, their adjustment turns out better. Um, so I think that location is a big factor to keep in mind as well. And just there's no harm in looking at the different facilities, try to gauge what is best. It's maybe a smaller facility that could be a little bit older, but feels a little sort of homey because it is that older style, or maybe a bigger facility that has more opportunity for, socialization and connection. Um, Maybe a facility that is designed to look like a vacation, maybe that's more of the style that your individual would prefer. And really, there are over 100 facilities in the St. Louis area, and you run the gamut of style and type, and um so it really is important to look along with where you are, where would be the best fit. So
And I think you have to be again aware when you say, oh, they'll be comfortable in this facility. It has to be what that elder person's comfortable with. I could walk in and think, oh, I'd love to be on a vacation all the time, in a
yeah,
place like that. But other people would be like, oh, I want to feel in this homey environment. So just being aware that it's not about you, it's about the person that's needing the care. And then this memory care thing, just really sticking with that too, that there's memory care in both assisted and skilled. A lot of the assisted livings, kind of advertise, oh, we're memory care, but they're assisted living still. And there is memory care and skilled, and some of the memory care and skilled are locked down, so when people call and they're like, I need memory care, a lot of facilities don't, you have to let the facility look at what the care needs are and tell you if they can handle them. Because a lot of the times the people don't have to be in a lockdown unit. They have enough where they can redirect. And if they're not a wander risk or different things, they're able to be in there and kind of mainstream-ish, for a term that might be helpful to understand. But um, because when you do go to assisted living as well, you're not really getting any assistance on benefits. You're getting the cash grant, which we'll talk about some more
Well,
on
and you do
Friday
have those
from.
facilities that might have independent and assisted, but they don't have skilled.
Hmm.
And that's a conversation to be had too, is are we looking at eventual skilled care? Because if we are, maybe it's better to look at a facility that sort of runs that whole gamut. And so you're not moving an elderly person multiple times. And yes, you would have to move them again, but it would be the same place. Also, when you have couples, um, a lot of times we have people that maybe one spouse will move into a independent living or even assisted living when the other spouse needs skilled care, because then they're, right across the street or one building down and can visit all the time. So these are all just good things to keep in mind of what does my situation look like and what type of care is best going to fit my needs, my want, or the elderly person's needs, wants, um, and
Uh,
all of that.
And it's so important. It is super complex, and most of us haven't gone through it. And so it's hard to, you know, get a good idea and know, and we don't have time to go to the 100 facilities that you mentioned, which there is 100 plus in this area. So kind of being able to narrow that down and figure out with you, what's important for the loved one, what's important for you, where are the people, what supports can be there, and just bringing that all together, which is kind of our, the point with it. But um, there's a lot of home-based services too that are available from agencies, from VA, from PT, OT, music therapy, housekeeping, meal deliveries. So there's a lot there. And so starting earlier on with some of those extra supports that can help with safety and help make sure that you don't fall down. Fall prevention is probably one of the bigger things that ends up costing, a lot of money going forward.
Gail
So,
and I just recently went to a presentation on fall prevention, and it's astonishing how often falls are sort of the beginning of an individual's decline. Especially for those people who fall and can't get up and can't get help for an extended period of time. It really is a big indicator. And one of the reasons that, as much as possible, if you can avoid those falls early on, you do extend longevity and quality of life a lot longer.
yeah. And there's just a lot of different things that you can help someone adjust to a nursing home that families can do, bringing in pictures and helping, making sure the furniture and just different things that really can help adjust. And so that's another thing that care managers can help with, and explain those adjustments. And sometimes, like you mentioned, that I told the gentleman to stop visiting right then, but he was going, his wife had such severe dementia that the amount of time that he was spending there right in the beginning was causing a lot more anxiety. So just letting her figure out a little bit of her environment, or maybe staying a shorter period. So there's different things that person would have to look at. So we do have like a lot of tips on adjusting and staying safe there. So maybe that'll be another presentation for a different
Yeah.
day, because there's a ton of them. But again, the role of a care manager is the advocacy and coordination piece, looking at bridging those gaps and supports for family transitions. Um, you know, what's the current situation? It can feel very confusing, and there's a lot of uncoordinated tasks going on. So looking at how to organize that, and what help will they maybe accept, focus on what parts that you as a caregiver can do, and what they will allow you to help them with, and just setting those realistic goals around that, and what can the family do? What different parts of the family, maybe siblings, what have you? How can you kind of get on that? But being connected with, helping to be connected with professionals that can put together and piece together those gaps in services and make sure everything's being accounted for. Um, and a lot of times care managers really can help better the communication between the doctors and the family and the other care providers because well, I don't have that perfect family that communicates everything all the time. So and I certainly watch, I've had many circumstances where you have different siblings and they won't even speak to each other. The parents are kind of in the middle with that or they can't go with their parent to the doctor and then the parent goes to the doctor, but they don't really necessarily ask the right questions or maybe they're having some memory loss. So they don't really remember what happened or it was so complicated. It just doesn't get communicated um, properly back to people that need to know what's happening. Um, so that coordination with the families and the doctors or even care providers, a lot of times some of the in-home care providers are coming, but they're not maybe doing what the elder needs or the way that what way they want it done, but they're afraid to say anything. They're afraid to for maybe some whatever the treatment is or the retribution or what have you. They're just afraid to communicate it. So having somebody else that's able to step in and call and get the services provided correctly is it's a big step.
Sort of just an example of that, Gail. I don't, um, we had a husband and wife who came in here and wife had an aneurysm and husband, was sort of thinking through what do I do now? She had a trach and a feeding tube and he wanted to keep her at home. She is still at home, but he had a couple care providers and he was pretty meticulously monitoring um what his care providers were monitoring and taking blood pressure readings and things like that. um but it's also a big conversation of you know are these care providers providing the type of care that you want in the way that you want and how much of that do you really need to be delegating, how much can you take on and how much of this should you sort of step away from and let the professionals do their jobs and do all of this, and for how long can we sustain the situation we're in is another big question in all of this. So if being at home is really important, okay, then that's when we start looking at sort of the financial side of things and saying, this is how much it's costing us every month to be exactly where we are right now. And this is just one situation where, the prognosis isn't improving at all anymore. So we're looking at pretty much 24/7 care for the rest of this woman's lifetime. And that's a hard thing to gauge. And I know one of the other attorneys who works here always says, if I had a crystal ball and I could tell you how much longer, there is, that'd make making a plan a whole lot easier. But since we don't know, it's why having professionals to help you with some of this planning and thinking through some of these things is so very important on the legal side, yes, but as much so on the care management and choosing care side of things.
Yeah, I think a lot of times the elder person they'll say, "Oh, they're coming, they're just watching TV, or you know, they're just looking at their phone, or what have you," and they're not. They can call out, they can ask for help, and the person's not coming, and so just looking at those aspects. Not to say because there is a lot of really, really good caregivers but there's circumstances and they're afraid or the people don't show up
Right.
or
And
maybe they
having access to those resources is so important too, you know?
Mhm.
If people like Gail know so many different care providers, you know, companies and
Mhm.
individuals and it's just not easy for, you know, the average individual who doesn't work in this area to know, okay, what companies are good. And if I don't like a care provider, is it good to ask for a new one or should I try another company or and what kind of things do I need to tell them up front
Mhm.
about my elderly relative, you know, maybe they don't like, you know, certain ways of being approached or certain ways of getting spoken to or you know things in their home are really important and they like their kitchen to be kept immaculate and these are all things that a care manager knows to watch for and to talk about.
Yeah. So in review, we're looking at again these things on the left. What's my priorities? Why does it matter? And who can help me with this? And so we're looking at really all these different things. That's the daily living support, health and safety, social connections, and our spiritual and emotional needs. And when we look at those things, what is the priority in that living area or health and safety? Why is that important to me? And who can help me with it? And so we're trying to put all of those pieces together um, when we're trying to connect and make that plan. Um, and going back to all those 8 core areas, you know, with the financials and the safety and the different help and just putting it together.
And that might be a good, you know, form of sort of reflection for anybody who listens to this is maybe write this down, you know, and we kind of talked about it as sort of like a flow chart or a chart, you know, go through each one of these questions. First, my priority and say, okay, what is my priority in regards to daily living support? What's my priority with health and safety? And then go back and answer, okay, why it matters to me and then go through each one. Same with who can help me with this, each one. And then at least you've started the process, right? At least you're thinking and you're asking yourself some of these questions. Or if you want to do it, you know, with your parents or your aunts and uncles or siblings, whoever you think might benefit from, okay, let's sit down and let's have a serious talk about what some of this looks like and what
Mhm.
your answers might be.
Because when you're looking at who can help, there's a lot of maybe smaller pieces, different pieces that different family members can can step in and help with. Um, and how you put that, you're trying to put it together so that the person can stay at whichever level of care safely and have that quality of life again, but also be able to afford to pay for it. So just piecing it all together and those priorities.
Yeah. All right. So what's next on this Friday, October 24th at 9:30 is our next presentation, and it's going to be sort of very broad overview of Medicaid and VA benefits. So in this area, we're talking mostly about skilled nursing care. So that's going to be vendor Medicaid, but we're also going to talk a little bit about in-home care. So home and community-based Medicaid, and then we'll go over VA aid and attendance. Again, just sort of broad overview. What are the basics? What do I need to know? And at what point could I qualify or be made to qualify for these services? Um, so I'm really excited about that. it's it should be a fun topic. And sort of fits in as far as we go through this series. Okay, we've talked about getting a plan in place. Why are plans important in the elder law context, in the estate planning context? We talked about those important legal documents that we need to have in place as soon as possible. And now we've talked about, okay, planning from the care manager side, right? So planning for what kind of care we're looking at and when. And so this sort of is the next step of that conversation, which would be, okay, now we need care from someone, a third party, who would be providing assistance with activities of daily living. So we've reached sort of a certain level of care needs at this point, and we're looking at how do we take the financial side and marry it with the care side and get someone the care they need for the amount of money they can afford to pay for it. Um, so yeah, so that's like I said, Friday, October 24th. It's at 9:30. So a little bit earlier on, but you can always watch it back as well. Um, did we get any questions, Gail?
I didn't see any pop up. But again, we monitor the comments on Facebook. If you do have a question, you put the comment there and we monitor that and we can get back to you about that as well. And then I think our next slide has the other dates, has all the dates. So I think after Friday, then there's 4 more. And we've usually been doing them at 11, but like you said, we changed the one for this Friday to 9:30. And
Yep, that's it.
yeah, so you can follow Aging Advantage on Facebook and also subscribe to the YouTube channel. After the class, the videos are downloaded onto the YouTube channel, so they're there. And again, we'd like to thank the City of St. Louis and the ARPA funds for the help in bringing this information to people. It's really important for them to, to just it's really important information to have and help in the community to get your benefits and then the programs that are needed.
Thanks, everybody.
Thanks. See you on Friday.